There are a lot of causes for lower motor neuron lesions. You can't say one. It may be an infection or a mechanical cause or an injury or something like that. But classically, how it presents, it will definitely present with a hyporeflexia. Okay. Uh, why hypotonia, hyporeflexia? You see that in the reflex arc, which is more important for the reflex arc, the sensory nerve fiber and the motor nerve fiber. Both of them are very essential. Okay, so both of them are very essential. If the sensory nerve fibers are affected, then also the information of tapping the tendon will not reach the spinal cord, and if the motor nerve fibers are affected, then also the reflexes will not be conveyed to the extrafusal muscle fibers. So both sensory as well as motor neuropathies can cause a reduced in tone and reflex. Next is the lack of muscle power will be lost. Okay, and sensory deficits based upon whether the peripheral nerve is a peripheral nerve involved is a sensory nerve or a whether it is a motor nerve, or in sensory nerve whether it is a C fiber or a delta fiber, based upon which the sensory nerve fibers sensory involvement can be recognized. Muscle wasting will be there because contractures and muscle wasting are very common here, because the muscle fibers are going to be less and the weakness is going to introduce a muscle imbalance, where for example if your biceps is strong and your triceps is weak, your positioning of the body part is going to be like this, where your biceps can be triceps which is weak can lose muscle, that is wasting. Okay, the primary muscle goes for wasting, and the contralateral muscle, that is the antagonist to that muscle, is going to go for contracture. You don't see much of muscle wasting in case of a stroke patient, because in stroke patient the tone is going to be high. The spasticity itself is a contracted state of a muscle. So when the muscle is in a contracted state, definitely it will not go for wasting. Very rarely you see wasting in the hand muscles of the stroke patients, but often you don't see much of wasting in stroke patients. You also, in case of this of a symptom, you also see a restrictive lung disease. Uh, Rarely balance will be affected in case if there is a proximal involvement of the peripheral nerve is there. Peripheral nerves that supplying to the proximal muscles, if they are involved, then definitely there will be a balance. But most often, not like the upper motor neuron lesion, you will not have a balance disorder. Gait abnormality based upon which nerve is involved. If the common peroneal nerve is involved, you will have a high stepping gait. Whereas if there is an involvement to the gluteal nerve, then you will have a waddling gait or a back lurching gait. Functional deficit based on the limb involved. If one limb is involved, the functional limitation will be less. Whereas if two lower limbs are involved, bilaterally symmetrical neuropathies, then the function will be even more involved. But the functional loss of a lower motor neuron, 9 out of 10 times, may not be as severe as that of a upper motor neuron lesion.